My name is Felicia. If you are new here, I go by FeliB on my blog, my Instagram, and all that good stuff. And I have endometriosis and PCOS. So I wanted to go ahead and cover when all of my reproductive issues started, how I figured out what everything was, and how long it took me to get diagnosed. So I remember when I was in 4th grade, my mom and I had to go to the doctor because I kept having all of these intense cramping pains in my lower abdomen towards my pelvic area. And I don't know how old you are in 4th grade, like 10 or 12 or something. And it was horrible, horrible pain. So we went to the doctor. They said, she's probably gonna have PCOS. It's what it sounds like. You probably just need to put her on birth control. So I've literally been on birth control for years. Luckily, my mom was like, we're gonna wait a little bit. We're gonna see what happens, la-di-da-da-da. So when I was in 4th grade, my mom had to go to my teacher and explain that I will randomly get horrible and intense pain in that area. And she just asked her to be like patient with me and understanding and to let my mom know if any of it is happening. So for a long time, I was just dealing with those pains. Like I hadn't started my period yet or anything like that, but I was still getting those pains. So come to the age of like 12 or 13, I finally got my period. And it was so irregular. I would have 2 or 3 periods in a month, and then I would go months without periods. And the bleeding was intense. I was such a young girl. I hadn't had periods before. I thought it was normal. So we go to the doctor. The doctor puts me on birth control at the age of 13. I was in 8th grade when I got on birth control for the first time. And it was great. Regulated my periods. It helped a little with acne, but not a lot. And if I ever wanted to have sex, I was good to go. But it didn't really solve it all the way. So throughout my teenhood and even to now when I'm 25, I would get horrible cystic acne all over my chin and kind of just throughout my face. And it was horrible, painful, disgusting looking. I hated it. I was so embarrassed by it. And I just kind of dealt with it. So I was on the pill for 2 or 3 years, and then I switched to the NuvaRing. The NuvaRing is a little circle like this big, and you kind of just fold it in half and you push it up inside your vagina for, I think, 21 days. Then you take it out for 7 days, you have your period. I really, really liked that, and I was on that for a long time, and everything seemed to be going good. I'd still have really bad cramps, really bad periods, but at least they were regulated. And that's what my doctor kept telling me. Your periods are regulated, everything's fine, la-di-da-da-da. But before I got on the NuvaRing, my doctor told me that since I had PCOS, it was going to be hard for me to have children. So at the age of 16, I was already told that it was going to be hard for me to have kids. Yeah. Can you imagine? I know they had mentioned it before at one of my earlier appointments, but I was only 13 or 14. I didn't care. I was like, oh, it's going to be hard for me to have kids. Oh, well. Once I was 16, I was like, that's a little weird. So I was on the NuvaRing until I was 20 years old, and then I got the IUD. I had looked up a lot about it. It apparently really helped with cramps because you're not getting all those hormones in your system. It's just the Miranda IUD, very little bit of hormones. You don't have to take it out every month. You don't have to worry about taking a pill every day. It's just a one and done thing for 5 years. So I really, really wanted it. I was on the IUD for about a year or so when I started to have some really weird changes. That first year was amazing. I didn't have a period. I loved it. I was like, I don't want a period. I hate when I have all these horrible cramps and bleeding, and I just hated it every month. And I was like, this is like God giving me a sign that he loves me, that I don't need a period. That year was probably the most pain-free year I have had regarding my reproductive system in my entire life. It was amazing. I was able to work out and run and everything without any pain. And then it was about a year and a couple months, I woke up in the middle of the night in so much pain that I couldn't even move. I was laying on my side when I woke up in the fetal position, and I could not move my legs to get out of it. I couldn't move my abdomen, and I was vomiting because I was in so much pain. I was crying. I couldn't even reach over to get my phone because I was in so much pain, and there was blood just covered around me. I thought I was miscarrying a baby because it was that bad. I was just like, what the heck is going on? And it lasted for about an hour and a half or 2 hours before I was able to move to go to the bathroom, to move, to call my mom and tell her what was going on. And I'm pretty sure my mom thought the same thing too. There was so much like clotting and tissues, and I was like, what is this? Like, I had no idea. So I called my doctor in the morning, and my doctor was like, oh, you should have gone to the emergency room, but you can come in right now. Well, I wish someone would have educated me on what regarding my bleeding is meant to go to the emergency room, because my whole life it was like, oh, it's just your period, it's just your PCOS, it's just this. So I went to the doctor for my emergency appointment, and she was like, oh, yep, you're never gonna be able to have kids. And I was 21 or 22 at this point. And I just remember crying. And she was like, I don't see anything that could have made you bleed, when she was doing my vaginal ultrasound and my vaginal check. And I was like, what do you mean? Like, this happened. I have pictures. There was blood everywhere. I was in so much pain. She's like, I just don't see it. So she prescribed me a prescription that was going to help this infection she said I had. And she just said I wasn't going to be able to have kids. So I went home, and I was so upset. And I was like, I know that there is something wrong. I know this isn't normal. This is horrible pain. So I started my little trip. So from March until August of that year, I kept track of every single time I bled, every single time I clotted, every single time I had pain, everything. And to go along with all my bleeding, I was having so many other issues medically as well. And it was all just being pushed kind of aside. So I was being constipated and wouldn't poop for 14 to 21 days. So 2 to 3 weeks I wouldn't poop. And then I would have diarrhea for days and days and days. And they just told me it was IBS. I was feeling like I was getting kidney infections all the time. I just need to drink more water. My mom has kidney infections, so it's because she has kidney infections. When I would go to the gym, I would run on the treadmill, and I would just get horrible pain in my lower abdomen. It would be like my lower right side near my pelvic bone. I assumed it was my right ovary popping a cyst or something. So I would just be running, and all of a sudden there would be blood going down my leg. I would have sex, blood everywhere. I would take a shower, randomly get pain, and start bleeding. All the time this was happening, and no one could tell me why. I went to my regular doctor, I went to my OBGYN. I had seen another doctor. No one knew what was wrong with me. So after about July, I had been searching, and all I could find was PCOS. Everyone kept saying PCOS. And then I found like one little article on endometriosis, and I sent it to my mom, and I was like, do you think I have this? And she was like, no, they never saw any weird things growing like in your ultrasounds. They never saw or thought these would be your symptoms. I feel like they would know it, right? Because they're doctors. So I did a lot of research, and I found a doctor. So if you are in the Peoria area and you're having similar problems, Dr. Teverbaugh in Peoria is amazing. I'll leave her information down below. I made my appointment at the beginning of July, and since I was going to be a new patient, I couldn't get in until the end of August. So I was like, oh, it's only a month. I'll just keep tracking. I'll keep doing. I remember pulling out my app and showing her, these are all the days I've bled. This is when I had cysts pop, or what I assumed. This is when it was such bad pain I was vomiting. This is when I was crying from the pain. Am I just being a weak little bitch, or is something going on? I remember sitting in that chair, and my doctor said, I think you have endometriosis. And I just started crying, because every doctor before that just told me that it was in my head, it's normal, I just have an irregular period, it's just PCOS, la-di-da-da-da. And I just started crying, because finally I had a doctor who knew what could be wrong with me. Doctor, she sat down and she explained it to me. She said she's had so many patients that have had this before, and she has helped them, and she has gotten that endometriosis removed and done things to help recover that. And I had never felt more validated. For all of those months I was having all of this pain. Since I was 12 years old, I was having pain that was just put off as being irregular periods or PCOS, and I was flabbergasted. In that appointment, my doctor was like, did they send over your records? And I was like, I requested them. We found out they never sent them over. So they called, and they really bugged them. So we were at the appointment for a while, and they got the records. And my doctor pulled out my ultrasound, and she said, if you look right here, both of your ovaries are covered in cysts. And some of them are gray, which could be endometriosis. And I just remember crying, because this was from ultrasounds in March, from the year before, from before I had my IUD, all of this, that they had seen both of my ovaries had issues, and no one thought it was necessary to tell me or help me. No, I never had seen a picture of my ovaries before. I didn't know they were covered in cysts. I knew that I had PCOS, but I didn't know there was like proof in the pudding. My doctor was like, so you definitely have PCOS, and that gray could either be it is filled with blood or it's endometriosis. So my doctor put me on a plan to try some things that worked, and then if they didn't work, my insurance would cover the laparoscopic surgery to remove endometriosis. With endometriosis, the only way that you can be diagnosed with it is through surgery. So I had basically just been like, I have endometriosis. I know I have it. Every single symptom afterwards that I looked up and that I had written down, they matched perfectly. Every single symptom. And I mean, I've been to doctor's offices where they literally type in what you have and they will have little columns come up to give you ideas of what you could have. So I don't understand how it took so long to get that diagnosis. My doctor said, we're gonna put you on metformin. It can help treat PCOS and it can help with fertility so that you'll actually ovulate, la-di-da-da-da. At this point, I was pretty thin. I was probably 125 pounds. And my doctor was like, you might lose more weight. Lose more weight without working out? I'm down, because I hadn't been able to run in months without having horrible pain. And I was so embarrassed going to the gym and having blood down my leg. Like, who wouldn't be? So I started taking my metformin. I was on 1,500 milligrams a day for about a year. I never lost weight. Instead, I gained weight, which I read that it can happen if you do have PCOS and endometriosis and you are thin to begin with. Some women still lose weight, but there is a little bit that gains weight. I gained weight. She did an intervaginal ultrasound and she said, look, both of your ovaries are entirely covered in cysts. So how she explained it to me was it's like a pearl necklace just wrapped around my ovaries. So every single spot on my ovary was essentially covered in a cyst. My ovaries were 3 to 4 times the size, depending on which one, that they are supposed to be, because they were so swollen and filled with so many cysts. And that, I was just like, holy crap, that explains so much. When I'm having all of this random pain, it's probably a cyst bursting. When I'm having this, it's probably this happening. And she was like, I still see those gray little spots. And she was like, but we didn't see endometriosis anywhere else on the ultrasound, which made me a little nervous for my surgery. I know that it can only be diagnosed through surgery, but I was like, I don't want to waste the money if there's nothing there. I was like, maybe it's just the PCOS. So we scheduled my surgery for January 11th of this year. So January 11th, 2018. So to do the endometriosis surgery, they go through your belly button, and then if they see anything, they do additional cuts to go in and laser out the endometriosis. So the day of, I was like, there's not gonna be anything there. It's just gonna be my cyst. I'm wasting money. My mom took off work. My husband took off work. They could be making money, but instead they're here with me for something I probably don't even. And I woke up from the surgery, had a panic attack because I'm just an anxious mess. They had to bring my mother back while I was waking up because they could not get me to calm down. And I remember my doctor coming in and saying, there was endometriosis and scar tissue everywhere. You have stage 4 endometriosis. Everywhere we looked, it was. So I had it covering my appendix. The endometriosis had stuck my fallopian tubes to the wall, which was basically blocking anything from happening. There was endometriosis all over my ovaries. There was endometriosis on my bladder, my colon, everywhere. There was endometriosis. PCOS is polycystic ovarian syndrome. So basically you just have a bunch of cysts on your ovaries that mess up your hormones. And these are some symptoms of it. Irregular periods or no periods at all. Difficulty getting pregnant because of the irregular ovulation. Excessive hair growth. It's usually on the face, chest, back, or buttocks. Weight gain. Thinning hair and hair loss on the head. Oily skin or acne. So those are like the top ones. So out of all of those, I had oily skin and irregular periods at this point. So endometriosis is when you have abnormal tissue growing. So there's some tissue that's normal, and then with endometriosis, it's just growing everywhere, like everywhere. So it can grow inside your uterus, on your colon, there was endometriosis everywhere. So there was endometriosis on my kidney and bladder, which explained why I was constantly feeling like I was having kidney and bladder infections. There was endometriosis on my colon and my intestines. It explains my IBS. There was endometriosis everywhere. Everything that was wrong with me was explained because I had extra tissue growing and taking over my body. So everything that was wrong with me was finally freaking explained. So I have some pictures. In this top picture, every single part that is shiny is endometriosis. And then down here, this is all scar tissue. So I had a ton of scar tissue and endometriosis. This is a ton of scar tissue as well. And then more endometriosis. And then this is it was like so much was lifted off of my heart and my shoulders because it wasn't just in my head. I wasn't just having this pain because I was weak. It was actually there. And it was stage 4 endometriosis. So you have stage 1, 2, 3, 4. So my doctor basically explained that endometriosis is cancer's cousin. So while it won't kill you per se, it's going to spread through your whole body. So back in the day, before they had laparoscopic surgeries, the only way to diagnose endometriosis was at death, because they would cut open like your brain and your abdomen and there would be the tissue everywhere. And that's how they diagnosed it. She said everywhere she could see inside my stomach, there was endometriosis. They even had to do an emergency appendectomy because my appendix was covered in so much endometriosis. Since it had spread throughout everywhere she could see, it's probably spread to my brain. It's spread to probably everywhere. And then my doctor was like, okay, so this is your time to get pregnant. Usually people with endometriosis and PCOS as bad as yours, the time to get pregnant is right after surgery. So this was in January. And she was like, I want to try to put you on a birth control, a very low dose birth control, just to keep the endometriosis from growing back, but you can still try to get pregnant. So we put me on birth control. It was called Taytula. And it worked really well for me. I have horrible depression and anxiety, and it didn't mess with that. It didn't make me feel uncomfortable. It just worked. But my insurance wouldn't cover it. So they tried to put me on something else. It didn't help me. I had horrible anxiety on it, even while I was on medication for that. So I just stopped taking them. That's kind of just what happened with my endometriosis and PCOS. I know my endometriosis is growing back because in March, I was getting these weird white tissued scabs all through my nose on the inside of both sides. And I kept telling my mom, I was like, Mom, look at it. And she's like, are you just picking your nose? And I was like, no, I'm not. Like, this is painful. It hurts to even like touch my nose like this. It feels like a cyst on the inside of my nose. My cystic acne is coming back. Like, what is going on? So I go to the doctor. I have endometriosis in my nose. There's only 2 other cases of endometriosis in the nose that have been reported medically. So my endometriosis is everywhere, and it took me years. My doctor said that when my symptoms I first had, she said that is telltale signs of endometriosis. So I have had endometriosis since I was at least 12 years old, and it took until I was 24 to be formally diagnosed with endometriosis. It took that long to get a doctor to believe me and not think that I was just a sensitive woman. It took that long to have a doctor take time to look at my scans and listen to my symptoms and see what's going on. It took that long. So right now, everything's pretty manageable. I am currently pregnant, thank the Lord. I have had 3 doctors tell me I would never get pregnant, and if I got pregnant, they said I would never be able to hold my child past 8 weeks. 3 doctors. So endometriosis can also grow in your uterus, which can essentially suffocate your baby while it's growing. So it can cause miscarriages and all that, and I'm pretty sure that's what happened. I was pregnant in July, and I'm pretty sure that's what happened. But now I'm pregnant, and it took all of this to even get the chance to get pregnant. So it took the metformin, it took surgery, it took cleaning out as much of me as they could for me to get pregnant. Someone asked how you find a good doctor. So for me, I did so much searching. I did Google searches, I read medical reviews, I posted on Facebook, I posted on Instagram. I did so much just to find a good recommendation. I think my cousin actually said she went to my doctor, or one of the doctors at the practice, and when I was looking her up, I read that Dr. Teverball is extremely patient. She understands her patients' like concerns and problems, and I was like, all right, she's covered by insurance, we'll go to her, we'll see what happens. This is kind of off topic, but kind of not on topic. How did you deal with other people getting pregnant around you? I know this is gonna sound shitty, but it's the truth, it's how I felt, and I know for a fact other people have felt this way. So my husband's sister, we were convinced she was gonna get pregnant before me. And I remember that I just told Jake, I said, if she gets pregnant before me, we have to move. I can't deal with someone getting pregnant that I'm this like close to, that we're gonna see all the time, all of that, while I'm trying so hard and I just feel like a failure and I can't do the one thing my body is supposed to do. So for me, it was so freaking hard. I remember scrolling on Facebook and seeing like all these girls getting pregnant, not even trying. They just say, oh, my husband looks at me and I get pregnant, or oh, we didn't use a condom one time and I'm pregnant. Oh, I forgot my birth control one time and I'm pregnant. And I just remember sitting there and crying because all I wanted was to be a mom and have a baby, and I couldn't even do that. So for me, it really took knowing that if I was ever blessed with a baby, I would give it the most love that I could, just like I hope all of these women are giving their babies the most love they could. My own personal story, that if I couldn't get pregnant, that wasn't the end of the road for me with having a child. I wanted to do adoption, or I would do foster care. I just know that I am that maternal person who needed to put my love out there, and I was going to figure out a way to do it. And although I was so freaking jealous every time I would get on Facebook and there would be another announcement or anything like that, I would just remind myself, I will be a mom in some way, shape, or form, even if this doesn't work and I don't get pregnant. If you listen to podcasts, Lauren Stewart has one called I'm Not Crazy, I'm Exhausted, and she has a podcast all about her journey with PCOS and infertility. And if you are struggling, I highly suggest listening to that because she puts everything in a perspective that is extremely understandable, and it will make you feel not so crazy. I felt like the biggest bitch when I told my husband we would move away if his sister got pregnant before me. And it really is stupid saying now, but it's how I felt because all I wanted was a kid. I couldn't even give my husband a kid. He's the older child. Like, if he wants a kid right now, I should be able to give it to him. Starting to cope with it is hard. Even now, it's hard. I know after if I have this baby, if I want to have another baby, I know it's going to be hard because it was so hard for this. And I just am trying to take the look. I'm just trying to have the outlook where God gives you what you can handle. If God didn't think I could handle seeing all of these women having successful pregnancies and having beautiful children and creating such beautiful lives, then he wouldn't show it to me. So I feel like he put me through this pain so that I can tell other people about it and help them cope. I have a friend going through a really bad infertility struggle right now, and I feel like if it wasn't for me knowing everything, I wouldn't be able to help her and to listen to her in the way I tried to. I mean, at least I hope it's a good way. How long did you know about your endo and PCOS before you got pregnant? Oh, if we go off what my handy dandy doctors told me, I've known I had PCOS since I was, let's say, 12 years old. For my endometriosis, my doctor told me in August that she thought I had endometriosis, but I was not technically diagnosed until January, since you could only be diagnosed through the surgery. So technically, for the PCOS, it was 12 years before I was able to get pregnant. I wasn't trying, obviously, the whole time, but 12 years. I tried for, Jake and I didn't use protection for 2 years. So 2 years, essentially, that I knew about my PCOS, and I was trying before I got pregnant. And with my endometriosis, we had been trying since January. So that was, I got pregnant in August, 7 months from endometriosis. How do you explain to your partner that you may not be able to have children? For me, I have always just been very straight up with Jake. We have a really good communication connection, and like we talk to each other extremely well. I remember when I was having all those issues and my original doctor said I won't be able to have children, I literally sat him down that night and I said, this is what my doctor said. I know you want kids. If this is a deal breaker, let's just end it now. This is how it is. I didn't want to lead him along thinking he could have children with me, and then it turned out that we couldn't. Luckily for me, Jake was like, fine, if you can't have kids, we'll find another way to do it. And Jake is just that kind of person. He's a very sweet and loving person. I don't know how I would have told him if it wasn't Jake, I'm not gonna lie, because Jake is the most understanding person I've ever met in my life. So I think you just need to be straight up with whoever it is. Your partner, you need to be like, hey, this is what I've got. We might struggle, we might not. It just kind of depends on which part of the cookie you get. But I just want to be upfront with you, and if it's something that's gonna bother us in the long run, let's end it now. My doctor will not listen to me, but I think I have endometriosis. How do I get them to take me seriously? Get another doctor. That's all I gotta say. It took me so many doctors to get all of this figured out, and I wish that I would have grown my own little lady balls and found my doctor sooner. She was a miracle worker when it came to this, and she knew exactly what was wrong with me right away and was so patient. So if you feel like your doctor's not taking you seriously, you're paying that copay. Your insurance is paying them. In some way, you're paying for it. So find a different doctor that you feel comfortable with and that is going to listen to what you have to say and help you figure out what's wrong. So that is all of the questions for now on my little endometriosis PCOS story. So if you have any more questions, go ahead and leave them below. And let me know if you have a diagnosis and if what your symptoms were similar to mine. Don't forget to subscribe because we will have more updates coming soon about how I got pregnant with my little baby and how I kind of dealt with everything up until that point and all that good stuff. And follow me on Instagram at FellyB. Bye guys!